Hello everyone, welcome to my channel Dental Guide. Today we will be solving MCQs related to developmental disturbances of oral and paraoral structures. Let's go to the first MCQ. Cleft lip occurs due to non-union of A. Maxillary process and frontonasal process, B. Maxillary process and mandibular process, C. Maxillary process and palatine process, D. Frontonasal process and palatine process. The correct answer is A. Maxillary process and frontonasal process. Let's go to another MCQ. Which among them is a mildest form of cleft lip? Lip furrow, paramedian lip, double lip, and lip pit. Correct answer is double lip. Double lip is the mildest form of cleft lip. Mildest form of cleft palate is bifid uvula. The uvula is the place where the minimal form of clefting of palate is observed. The line of the cleft lip always starts from midline of the alveolus towards outside between central incisor and midline, lateral part of lip through philtrum to alveolus inside between lateral incisor and canine tooth, midline of the philtrum towards alveolus inside between central incisors, lateral part of anterior alveolus towards outside between lateral incisor and the canine tooth. The correct answer is B. Lateral part of lip through philtrum to alveolus inside between lateral incisor and the canine tooth. Median maxillary anterior alveolus cleft occurs as a result of defective formation of frontonasal prominence, lateral nasal prominence, lens placode, mandibular prominence. The correct answer is A. Frontonasal prominence. It is relatively common defect occurring in approximately 1% of population. It results from mesenchymal deficiency, which causes partial or complete failure of the medial nasal prominences to merge and form the intermaxillary segment. Cleft lip and palate can be detected at first using ultrasound technology during 10th week of gestation, 16th week of gestation, 24th week of gestation, 5th week of gestation. The correct answer is A. 10th week of gestation. The cleft lip occurs due to disturbances in 6 to 8 weeks of intrauterine life, whereas cleft palate results from disturbances in 8 to 10 weeks of intrauterine life. The palate begins to develop around 6th week of intrauterine life and proceeds until 11th week of intrauterine life. True about cleft lip and palate. Polygenic is most common and high risk type. Polygenic is less common and low risk type. Monogenic is most common and less risk type. Monogenic is less common and high risk type. The correct answer is D. Monogenic is less common and high risk type. The most common is hereditary, its nature being most probably polygenic and non-syndromic. The threshold value is sufficiently high, that is, it is low risk type. The second form of cleft is monogenic or syndromic and is associated with a variety of other congenital anomalies, which is high risk type. Multifactorial inheritance is the result of polygenic effect together with environmental factors. Most common cleft lip defect is A. Isolated bilateral deformities, B. Isolated left unilateral deformities, C. Bilateral cleft lip with palate, D. Unilateral cleft lip with palate. The correct answer is D. Unilateral cleft lip with palate. The typical disturbance of cleft types is cleft lip alone 15%, cleft lip and palate 45%, isolated cleft palate 40%. Question number 8. Which of the following is considered as separate entity due to its epidemiology, etiology, and genetics? A. Unilateral cleft lip and palate, B. Cleft lip, C. Bilateral cleft lip and palate, D. Isolated cleft palate. The correct answer is isolated cleft palate. Approximately 70% of cases of cleft lip palate occurs as isolated entities with no other apparent congenital or structural abnormalities. Clinical features of submucous cleft deformity is A. Bifid uvula, B. Notching of the posterior edge of the hard palate, C. Midline translucency of soft palate, D. All of the above. The correct answer is D. All of the above. Question number 10. Cleft lip most commonly occurs on A. Middle, B. Right side, C. Left side, D. Equal both sides. The correct answer is C. Left side. Question number 11. Incidence of cleft lip seen in Caucasians is 1 by 100, 1 by 400, 1 by 800 or 1 by 1000. The correct answer is D. 1 by 1000. Which of the following shows lowest frequency of the cleft lip and palate? A. Negroes, B. Afghans, C. Red Indians, D. Indians. The correct answer is A. Negroes. Clefts exhibit racial predilections, occurring less frequently in blacks and highest in Mongoloids and Afghans. Question number 13. The abnormalities of tooth morphology in cleft lip and palate patients are mostly observed in primary and permanent teeth. A. Mandibular molars, B. Maxillary incisors, C. Maxillary molars, D. Mandibular incisors. The correct answer is maxillary incisors. Cleft palate patients generally show missing lateral incisors. Question number 14. A critical factor in the regulation of craniofacial development. A. Sonic hedgehog, B. Fibroblast growth factor, C. Wingless Drosophila melanogaster segment polarity gene, D. Bone morphogenic protein. The correct answer is A. Sonic hedgehog protein. Sonic hedgehog is a protein switched on by retinoic acid, which along with fibroblast growth factor has been located in the ectoderm of the frontonasal and maxillary processes in chick embryos. Sonic hedgehog may act as an organizer of morphogenesis of certain important structures of the craniofacial region. Question 15. Tooth bud initiation and positioning is determined by A. MX4 gene, B. MX3 gene, C. MX2 gene, D. MX1 gene. The correct answer is MX1 gene. MX1 initiates developmental position, MX2 further development of the tooth buds. Question number 16. The syndrome associated with bilateral pits of the lip and cleft palate is known as A. Cowden syndrome, B. Esser syndrome, C. Vanderroot syndrome, D. Greenspan syndrome. The correct answer is C. Vanderroot syndrome. Vanderroot syndrome, also called a cleft lip syndrome, lip pit syndrome, dimple papillae of lip. It is autosomal dominant due to the deletion of 1q32 chromosome band. Hallmark is association of lower lip with cleft lip and palate. A 2-year-old child presents with cleft of the hard and soft palate which extends till the incisive foramen. According to Vaugh's classification, this case comes under A. Group 1, B. Group 2, C. Group 3, D. Group 4. The correct answer is B. Group 2. Let's talk about the Vaugh's classification. Group 1st, defects of soft palate only. Group 2, defects involving the hard palate and soft palate. Group 3, defects involving the soft palate to the alveolus, usually involving the lip. Group 4, complete palatal clefts. According to Vaugh's classification, isolated cleft palate comes under A. Group 1, B. Group 2, C. Group 3, D. Group 4. The correct answer is B. Group 2. Gene responsible for ectodermal dysplasia with cleft lip and palate is PVRL, TP63, ED14, FCFR2. The correct answer is B. TP63. Dentinogenesis is initiated by BMP3, BMP5, BMP7 or BMP9. The correct answer is BMP7. BMP7 usually appears to induce dentinogenesis. The fibroblast growth factor FGF8 and FGF9 in dental mesenchyme tooth development. Shape is regulated by and via downstream factors MX1 and PAX9.